Recording in progress.
In the chat, she's asking if they can.
Yes, I hear.
Okay, great. Well, welcome everyone. Good afternoon. My name is Teresa Castillo, and I'm the Chief Program Officer for HealthRight International. On behalf of HealthRight and NYU's GPH Department of Global and Environmental Health, I welcome you to this jointly sponsored event, Unyielding Determination, Brave Hearts, United Souls. I'm honored to have our Ukraine colleagues with us here today. First, we have Halina Skipalska, HealthRight Ukraine's Country Director and Executive Director of the Ukrainian Foundation for Public Health, and also Anna Saienko, our Associate Program Director from HealthRight Ukraine. Over the years, we've hosted Halina several times to share her reflections on Ukraine's pressing health issues. And we are very excited that she is here once again with Anna to shine the spotlight on the mental health and well-being of humanitarian workers. Recent years have been riddled with the 3 C's: COVID-19, conflict, and climate change. And here are a few stats to reflect some of the challenges that have arisen. In a recent 2021 article, Solveig et al. Presents the case for a broader call to prioritize the mental health and well-being of healthcare workers. Authors assert that public health emergencies exacerbate these concerns, thereby ranking frontline workers' mental health an urgent global public health priority. Stress and vicarious trauma through their work. All of these are compelling facts and statistics, which lay the foreground for today's discussion. In the context of Ukraine, it has been 2 years since Russia's full-scale invasion, and over 14 million people are still in need of some form of humanitarian assistance. Our dedicated team has been able to reach over 1.7 million individuals directly since the escalation of the war. Their bravery and resilience continues to inspire and motivate all of us. Today, Halina and Anna will highlight HealthRight's Caring for Carers initiative, which is an organizational response to staff well-being and mental health through adaptive policies, counseling, and safe space programming. And without further ado, please join me in welcoming Halina and Anna.
Thank you for this opportunity to be here together with you. about this sound. Sometimes we hear this sound even in Kiev 2, 3, 4 times per night. You as a future public health workers probably know how bad it's not to wake up during night. So for us, it's absolutely normal now to wake up 2, 3, 4 times, not only from this sound, but also from some explosions when we don't hear this sound during our sleep. This is only sound, but can you imagine how hard it is for other health providers to work from bomb shelter? How hard it is to do surgery in bomb shelter, to give birth newborn children, or even to provide some psychological consultations, to provide some counseling to your patient, even when you have access to internet, but you are in very unsafe conditions, and plus you hear explosions or air alarm. And actually yesterday it was accounted 1,000 air alarm in Kyiv city. So, and in the locations and cities more closer to conflict line, people hear the sound 5-10 times more often. So this is why today we are speaking about actually mental health of professionals, and about some initiatives initiated by HealthRight International. Here you can see current figures about that demonstrate statistic and needs which Ukraine still has. So we have more than 17 million people in need. These are data just shared by UN OCHA, you can see from 14th of March this year. 11 million people were already reached as of December of 2023. We have about 4 million internal displaced people and about 6 million refugees only in European countries. Next, please. So HealthRight International, we are in Ukraine since we have been working in Ukraine since 2005, and actually our work, humanitarian work, started in 2014. But after full-scale invasion, we expanded our programs, and as for now have about 300 specialists, social workers, humanitarian workers, psychologists, general practitioners, nurses who continue to work even in such difficult conditions. Here is another overview of situation as of March 2024 about mental health. So approximately 4 million people are suffering from moderate to severe symptoms. It's a WHO statistic. Over 1.5 million girls and boys require some form of assistance in managing stress and anxiety and other mental health issues. We have everyday requests to our different services and hotline and Safe Women Hub online platform. We have requests from people who suffer from different mental health aspects, issues. Next, please. This is why we, together with support of HealthRight HQ and some other experts, started thinking about staff welfare model and developed Caring for Care, which we call C4C intervention. The goal of this intervention is to address the unique challenges facing the staff, as well as provide tested tools and resources for mental health, well-help, coping mechanisms and systems for additional aid. Caring for Care now, it's very important in Ukraine because as we understand that with each additional month of war, we are more and more traumatized. And also there is more and more demand from our patients and clients which are seeking for our help. So we have as a specialist to give in resource. So Caring for Care staff model, here you can see what it includes, how it was developed through co-creation workshops with other specialists. So in development of caring for care initiatives, were involved 2 experts, and we appreciate their support and initiative. Courtney Welton Mitchell, director from Climate and Disaster Resilience, Colorado School of Public Health, and Navaraj Upadhyaya, director of Global Mental Health at HealthRight International. At the beginning, what we did, at the end of actually 2022, we started from online survey that was conducted with more than 300 employees participating. The survey included questions focused on different aspects, on demographics, staff support needed, including stressing factors and coping methods, social support, benefit seeking, different post-traumatic growth, and receiving support within the organization, and ideas and suggestions for group support meetings. So actually we started from asking questions, our specialists, what will be helpful? What are their current conditions and status? How organization can help them? As a result, there were developed few initiatives, and today we are speaking about caring for cares, and my colleague Anna will speak more on this. Here, I would like to show you a few examples how we take care for our staff in Ukraine. So we with our HR team and PR team developed very simple leaflet where we put together all information about support we can provide for staff. So for instance, 1 time per month, we provide professional supervisions by team of psychotherapists. For whom? For all staff working with people in our day center, halfway houses, shelters, mobile teams, integrated centers, and also Barnahus centers. So actually, supervision sessions are included in all projects. We demand also donors and advocates that it's the 3rd year of war, they have to demand also from other grantees to include supervision sessions for specialists who work with people. 1 time per month, we also provide group meetings in the office for recovery by a team of psychotherapists. For staff in Kyiv, we also try to practice this in Lviv and Uzhhorod. And 1-2 times per month, we also do different team building activities for all staff in Kyiv office. It can be just joint watching of some professional movie. It can be some celebration of some birthday party and etc. Next, please. We also, with support from our HQ, have great approach. 3 times per year, we recognize the achievements of employees in format of online event. Yes, it is in cooperation with our HR team and also program and management people of HealthRight International. And it's very well accepted when our staff celebrate together achievements of other staff. And during the year, also, we provide individual support with psychotherapists and supervisor. Here we have information about Oksana Karalovich, who is our lead of supervisory team. So to whom staff of the Kyiv office, but in case when some of our staff face some problems, meaning something happened, for example, they lost some relatives, there was drone that targeted apartment, or there was building destroyed where some employee lives, then we provide up to 6 not supervision, but psychotherapeutic meetings for this person. For example, there was case when at the end of December, drone targeted building of one of our employees, and it is hard, and we provide services and psychological support for this person. And every few months it happened with some staff actually. Also, we conduct regular surveys on wishes for events and their formats to support mental health issues. We Also during the year, generate retreats, festive events, celebrations of important events out of town vacations, corporate parties, and birthday parties. Up to, yes, and also part of this system is up to 6 meetings of the program in caring for cares if necessary. And now we try to develop more system on implementation of caring for cares intervention. And here I would like to give space for my colleague, Anna Saienko. She is for the first time in New York. She also arrived there. Yeah.
It's okay. So over 14 millions of people are in need and seek for some support, especially psychological support, and they need urgent help. Amidst of this turmoil, our frontline workers stand as beacons of hope and providing essential support to communities in distress. And on this photo, you can see our psychologists from multidisciplinary mobile team who started in March 2022 and provide support for internally displaced person on the railway station in western of Ukraine. Now I want to share with you 2 stories of our staff members, Olga and Natalia. They will share their own experience when the war started. It's on the video.
Чесно кажучи, я не вірила в те, що буде повномасштабна така війна, не вірила до останнього. Насправді була дуже велика підтримка і була дуже велика підготовка до того. Наша директорка Галина максимально всіх готувала, колеги розробили порядок дій в рамках перед тим, що нам потрібно робити, як евакуюватися, що робити, куди бігти. Да? Тривожний рюкзак ми зібрали і купили переноски для наших котів. Завдяки цьому перші дні, коли дійсно було дуже таки тривожно, і ми не знали, як реагувати, що робити, і наскільки серйозно, і наскільки довго це все буде, ми змогли ходити на ніч в метро з нашими улюбленцями. І ти вже сидиш і думаєш, так, а чим я можу бути корисна? Там, ага, давай там ми подумаємо. І тут директорка каже, давай думати, як ми будемо змінювати проєкт, щоб можна було його реалізовувати. От, і це дуже включало, і це, напевно, відволікало, да, і більше таке зосередження не тому, як це жахливо, да, а що ти можеш зробити для того, щоб трошки не так було. Напевно, це є українська незламність, коли ти бачиш, щось відбувається таке, да, ти думаєш, як відреагувати і як допомогти цим людям. Це, напевно, те, що рухає і мене, і більшість наших колег. І це те, що допомагає не здаватися, а навпаки, те, про що я говорила на початку, максимально включатися і допомагати тим, кому гірше.
Я дивлюсь на це відео, кажу, не може бути. Це, каже, якийсь мем. Ну, таке не може бути в нашому сучасному світі, якби в Європі. Я заходжу в Фейсбук, перше, що я бачу, Київ бомблять. Ти не віриш, ти вибігаєш на балкон, ти відкриваєш вікна, дивишся, де. На 7-й годині я виїжджаю, беру дитину, виїжджаємо з Києва. Над тобою чуєш вибухи, десь зривається там. Дитина питає, мама, що це? Ну, зрив, так, да. Заспокоюю сина, заспокоююся, беру себе якось в руки. До Ужгорода ми добиралися замість 10 годин 36 годин, за кермом, без сну. І я в Фейсбуці читаю новину. Якраз загинув мій друг, який боронив Київ. Кажу, Тарас, я виїжджаю, тебе підібрати. Він тоді ще шуткував. Каже, я буду довго сумку збирати. Це лише один мій такий із знайомих, в якого 3 дітей осиротіло. Що нас не вбиває, то робить сильніше. Саме так. Тому раз я живу і маю можливість бути тут корисною, працювати, допомагати, створювати нові якісь послуги, створювати нові сервіси, я це буду робити.
As you see, mental health support is important for now. And when we're talking about crisis and humanitarian settings, it's crucial for our frontline heroes, because this girl which you see on videos, they're still working with us, and they coordinate big projects which support for women, girls, adolescents, for IDPs, internally displaced persons, and for people who suffered from the war. It's not only aid for healing of psychological wounds, but also ensures to continued availability to support our beneficiaries. And with thanks to our headquarters, we have this great opportunity to piloting C4C programming, and for us it's now very important. When we're talking about C4C programming, as Galina mentioned, we start from survey to design needs of our personnel, and then we developed with experts tailored program, which includes TOT of trainers or facilitation of this session. And Natalia also joined this TOT, and now she also provides support to our colleagues, because for us C4C it's mostly about peer support. Yes, when you see that your colleague is not ok, you can just talk with them, propose some coffee, water, or only to hear about their stories, why it's not now it's normal, yes, and support them. But also we can provide group intervention and group session. C4C include 6 sessions. It starts from stress factors, and then how people can help themselves, or which instruments they can use to stable their mental health. But at the same time, we understand that it's piloting and we have some challenges, especially in the country where war continues. And also we understand that these challenges, it's also our lessons learned. For example, in our culture, it's not popular to seek help in psychologist, psychotherapist, or a psychiatrist. And for us, it was important to understand and respecting diverse attitudes toward mental health, and has been in K. Also, we understand that C4C, it's not about mandatory. It's voluntary participation, and we propose it for each one, and they can choose, do they need join to our C4C programming, or we understand that sometimes they have privacy concern and they can seek help in external services, and we provide these leaflets. And also we have information from different opportunities how to help themselves or another organization where they can take this support in another ways. Also, we understand that in case of the war, we have some technical limitation, because last year it was a time of burnout, without electricity, without internet connection, etc. But at the same time, we understand that it's also important to be flexible. You need to understand that if it's can be also some disruptions from air alarms or explosion. And now our colleagues can take a face-to-face session or jump into online session, or they go into the bomb shelter and continue communicate with each other for supporting. The next one is heavy workloads, because as you heard, we covered more than 1.5 million people, and for our heroes, I always call them heroes. It's very heavy, but at the same time, we remark that it's important to have some breaks. It's important to take care from themselves. And please, if you need and you understand that burnout, it's very close to you, seek the help, ask us for them. We have so many opportunities to support you, because you also need to be with us, and it's a great opportunity for communication, for another different opportunities, like, okay, you need a leave, okay, we will seek for exit for these questions or something like this, and we are the team, because C4C, it's also about team building. And when we're talking about personal trauma, yes, we have different cases from our personnel, and our program supports individuals dealing the personal impacts of the war and recognize this journey of healing together with us and with our support in different ways. And also, colleague, please can you next slide with video. It's also one of the story of our colleague. When the full scale starts, she was in Lugansk region. Now it's a fully temporary occupied region in Ukraine. And Hannah shared with us her experience, how they leave these occupied territories after beginning of full scale invasion.
З перших днів повномасштабного вторгнення в нашому спільному чаті в Вайбері ми переписувались і підтримували один одного. Була інформація про те, що чи там відбувається вибух. Щодня у мене питали, як я, і говорили про те, що вони зі мною. Це була потужна підтримка. Мені матеріальну підтримку організація дала, за рахунок чого ми там змогли зняти житло, якийсь елементарний бит собі організувати, і ця підтримка продовжується по сьогоднішній день. Також велику роль відіграють ці супервізійні зустрічі, коли я спілкуюся з супервізором індивідуально, моє ментальне здоров'я підтримується. Сам факт того, що у мене є робота, що я можу, по-перше, реалізовувати свій потенціал, бути корисною людям. По-друге, я маю фінансову винагороду за свою працю, і за рахунок цього також можу допомагати своїй родині. Це надважливо. І я вдячна, що у мене це є.
Our C4C is the most importantly that we design it to be flexible and adaptable. It's a foundational model which we can be tailored to meet specific needs. If someone wants face-to-face session or online session, if you want group discussion, etc., we are open for it, and we seek the best way and do our best. And also we can offer for our colleagues support and resilience for those who need this it most. And as we look ahead, we are inspired by the stories of resilience and hope. Our program is more than series of the session. It's commitment to supporting one other and recognize that other, and we can rise from adversity stronger and more until it. And also we are like rising phoenix. We burning out and we reborn every day and every minute. And thank you for allowing me to share our journey with this program and impact of the caring for cares. And together we can building a future where support and care go hand in hand with resilience and recovery. And we also have one more video, sorry, to share how it starts. It's a new documentary film provided by a famous regisseur in Ukraine. Its name's Horrible Day, but it's collected videos, photos from different citizens in Ukraine, how it was when full-scale invasion started.
Мы до последнего не верили, что такое может быть. И вот сегодня нас разбудили с утра, и как-то так у нас война. Никогда не думала, что я буду там, где война будет.
Вы убегали из своего собственного дома когда-нибудь? Нет? Не знаете, что это за ощущение? Вот хочу вам, чтобы вы никогда его не знали.
Понятия не имею, что делать. Сидеть здесь, ждать, пока они нападут и заберут нас, оккупируют. Я не хочу быть в Росії. Люди, забудьте про те, що ви можете уїжджати час від своєї сім'ї. Проводьте більше часу з вашою сім'єю. Люблю вас. Це може закінчитись.
Такие у нас спасители русского мира.
Дом разрушен полностью.
Варвари наскочили, промародьорили, розграбили, розвалили, розрушили, розстріляли.
Хочу попросить вас, кто остался, держитесь. Это все закончится. Главное — не сломать наш дух.
Попри все на світі, їм ніколи не вдасться вкрасти наші мрії, вміння любити, вміння помічати красу. Тому ми точно не здамося.
Даже если вы нас всех убьете, мы встанем из мертвых и отомстим!
Братушек, братичек.
Да, давай, пистолет наставь на меня!
Я украинка, слышишь? Катя, я тебя люблю. Я тебя.
Stay with us and be brave like Ukrainians. Thank you.
Thank you so much, colleagues. The atrocities and gravities of the war and the heroism that you exhibit never ceases to me. Thank you. And with that, I'd like to open it up for discussion. I know we're monitoring questions online as well as here in person. So feel free to raise your hand and share any questions that you may have.
Thank you for, well, that was a real drag. Thank you for sharing all of that. You guys have done this amazing program, this Cares for the Cares program, but I also know you work with so many organizations in Ukraine, like other NGOs on the ground. Are you getting requests from them to participate in Cares for the, like, because they have their own staff? Or are they asking you to help them set up a similar program? How is that working? Because that must be an additional strain, and I just was curious.
May I start answering? So at the end, actually, we observed that at the beginning of second year of war, the attention was drawn to the issue of mental health. There was, maybe heard, Diana, about the huge initiative announced by First Lady Office with WHO regional office from Copenhagen, focused on mental health. So people starting at least thinking about this. And our government attention was drawn to this issue. So at the same time, there were other organizations like voluntary groups, civil society organizations, who announced that they need support, provide support for their staff. We didn't have any specific requests to share Caring for Care, our model, because it's just at the stage of piloting given by us. But at the same time, we implement one small initiative together with one partner organization and provide supervision support for their staff who works in Kherson and Kharkiv, two very hard and close to active hostilities regions. So there are also discussions, there are donors discussions around the issue of inclusion of some budgets for mental health support for humanitarian workers into project proposals. It's hard because when finally you hear that the budget is cut, then usually you cut actually this part that should be dedicated to the mental health support for your staff. So it's still process, and this is why we are grateful and have to have this event here in New York, because through this way we also can draw attention to the issue of resilience, mental health status of humanitarian workers. So there are discussions and we work on this. Some other organizations, they also involve at least the psychologists outside of organization to provide some support for those who face some difficulties in life, because humanitarian workers, they live in war conditions. They also have relatives in army. They also have apartments, can have apartments destroyed. So and in this case, most difficult case, we know that for 1 month, we don't have this worker. He or she cannot even work appropriately when something happens. So for these cases, international, local organizations, even international organizations involve psychotherapists, psychologists, supervisors, but I would say that it's still not a system in our setting.
Great, thanks.
Thanks, Helena. One question that we have for both of you is, how has your definition of resilience changed over the past 2 years?
Maybe I can start because when full-scale invasion starts, it was about suffering. It was about how to save our lives, life of our relatives, etc. But now we understand that life is continuous. We need to be strong. We need to be, we need to be strong, and we need to understand how we can support another people, because not always they have access to good services, qualified services, and for me, especially resilience for now, it's continue life, my life. Every day, every time, every minute, because we didn't know what will be tomorrow.
Yeah, thank you, Anya. It's hard what to add. So I just want to add that it's hard, but experience, and we just think how to use this experience in the future. So we really, so we understand, as in that movie we watched it, that we have to we have to live life of better quality, to communicate with our relatives and children, to maybe I observe that a lot of people actually try to live healthy life, meaning to take care for body, for health and other issues, because we understand that during 2 years we didn't pay attention to this. We didn't take care for our even health and body. The diagnostic was available, but people didn't go to doctors because we accumulated all resources to fight. And now we understand that we just want to live normal life, but even in such hard conditions. So still, it's experience. And we hope that we will win, and there will be future without war. And then we have experience and understanding how we can build this ideal Ukraine, let's say. Yeah.
Thank you. I think we have a question from online. Henny?
Yes. So it says, I wanted to ask you how day-to-day functioning, education, supplies, access to healthcare continues, and also wondering about the aging population.
Oh, yeah. So no one knows actually a real demographic status of those Ukrainians who now live in countries. So we knew that those who are displaced are women with children. Refugees are mainly women with children. But how is situation with elderly? No one really knows. We also understand that, but again, judging from our experience and work, that, for example, in these regions close to conflict line, there are a lot of elderly who decided to stay, and they live in much harder conditions comparing to, let's say, those who live in central part or west of Ukraine. But for elderly, it's also hard to imagine how they can be integrated in new places where they moved. So it's unbelievable, but no one knows how it looks like. So surely there should be developed some additional interventions and interventions to support those who are like 70 plus or 60 plus, because even we understand, do not have access to, for example, online options like they cannot receive consultation via WhatsApp or Zoom, because it's even we have access to online resources through all Ukraine in such war conditions, but they usually don't have this access. They cannot go take consultation. So it's hard. We have to look into demographics issues and then understand and plan interventions.
And also they are not so flexible to change their life, because they said that here is our home, here is our roots. We didn't want to displace somewhere. It's when we live, then we die here if it's our future.
We have time for 2 more questions. Yes, please.
Hi, my name is Jean. I've been involved with HealthRight for about 10 years, and I just want to say the Ukraine team, even before all this, has been so, you're legendary. So this is like my fangirling moment. So thank you for being here. The question that I had was, this is an amazing program, and having been involved with nonprofit myself, convincing the donor must have been really hard, because they usually hate, internal admin costs is sort of how they see it. So how did that conversation go, and how did you manage to convince the funders to be able to start a pilot program? You touched upon it a little bit, but I'd like to hear a little bit more.
Sure, I can answer this question. So yes, it is a difficult conversation to have with donors, because some are more sophisticated and able to see the value of it. And others less so. For us, we were very fortunate because we had access to unrestricted resources that we had raised through our Ukraine Relief Fund. And that has really helped us in jumpstarting this pilot test phase. But in addition to that, as you can imagine, having been in Ukraine for over 15 years, once the war escalated, there were a host of donors and organizations, INGOs, that were coming to Ukraine looking for partnership. And HealthRight Ukraine was an ideal partner, and we brought that to the table. We negotiated with these different partners, with these different donors, and said, if you want to partner with us, you need to support us in supporting our staff. So to set aside budget line items for staff welfare is a critical part of partnership, just as much as monitoring and evaluation is a part of that budget. So we came to a good understanding with the majority of our donors, and there's still some that are lagging and need to catch up. Yeah. Yes, please.
So really wonderful to hear you. I've been in global health more than 50 years and really never heard of presentations like this. I can't help but ask you, you're in this country now. You turn on the television, you hear the news. We just had a visit from a Hungarian leader visiting our ex-president, saying you heard the outcome of that, I'm sure, about support to Ukraine. I'm just wondering how you feel about the future when you hear and see what's happening in this country. How does that affect your, I know it's a hard question, but it must be on your mind 24/7. I mean,
And they are here for the commission on the staff.
yeah, I know.
So
You can
it's
talk about
timely,
that.
they're at the UN.
And it's one thing to hear it in Ukraine. It's another thing when you turn on your television here and hear what we hear, which is all very sad, but so wrapped up in larger political issues. I just wondered if you would share with us, if you can, how that makes you feel.
Yeah, thank you. Thank you for this question. Yes, we are optimistic, but we don't live in illusion. So we understand reality. And we know that many our donors, partners, our politicians are looking for results of US elections. And this is truth. So depending on this, we will know which of scenarios which we have developed in our portfolio will be implemented. At the same time, we want to, so it's 21st century. We were and are independent country. How it could happen? When I watch latest movies on Flux, Netflix, sorry, Netflix.
Flux is our grants manager platform.
Netflix on second war. I couldn't believe the same scenarios, the same behavior of the same.
Кто здесь типа знает, что это? Ну, я
Колеги, будь ласка, вимкніть звук.
So the same scenarios, the same, but with another name, dictator. So it's unbelievable. After 100 years, we repeat the same issues. So we think that fighting for Ukraine, it's fighting for democracy world. So it's we don't think that Russia will occupy all Ukraine or etc. So we don't want. We are independent country. We are Ukrainians, and we will fight. We are there. Our children are there, so we think that we should win, and we don't consider even other scenarios. But at the same time, understand that this is huge political game, and we hope that American also will vote meaningfully. Let's say so.
And maybe just as we come to a close, maybe I can just reflect on how we are assessing the impact of this initiative. We're very fortunate to work with some NYU faculty, including Lloyd Goldsams, who's here with us today, on the Caring for the Carers initiative. We are currently in the process of writing up a manuscript to document the first part of what we've done. Both Courtney and Nawaraj are finalizing that hopefully this month so that we can submit. So our fingers are crossed that will actually go in And we're looking forward to more iterations of this model. Currently, we are rolling out the same model in our Kenya country office as well as our Uganda office. We also want to bring this to our US office. We are not a top-down organization. We all need mental health and well-being. So we're looking for ways to build it into our everyday work and codify it in our policies. So it's an ongoing process for sure. And we're learning along the way, and we intend to document our lessons learned. So with that, perhaps we can just give a round of applause to both. Thank you so much for your experiences. We are standing with you. And please feel free, we have lots of refreshments. We have the room for another half hour or so, so please come, meet them, talk to them. Thank you for your participation.
I just slowed down and I was like, that was the easiest part of her day. That's what we're naming the baby. I imagine. Yeah, you're